Take a look here. All right, good afternoon. Thank you so much for joining. We're just going to give folks a minute now that the webinar is open to join. Okay. Happy Wednesday, everyone. Good afternoon. Thank you so much for being here with us today. My name is Ruth Abaya. I am a Senior Director for Health Systems and CVI Integration at the HAVI. I'm a Senior Clinical Advisor at the Kaiser Permanente Center for Gun Violence Research and Education. And I am really delighted to be hosting this conversation today. We're going to be talking about navigating institutional review boards in firearm injury research and what you need to know. For some context, this topic was decided in part due to the relationship Kaiser Permanente Center has with grantees and with applicants, and some conversations that we have had about what would foster more research capacity within the firearm research landscape. IRBs come up a lot in that context. There have been a lot of questions about how to really do the kind of work that we do in the populations that we do it in suicide prevention and community violence intervention, intimate partner violence, and all of the other areas where many of us work. How do you do this work in a way that does protect human subjects research? And then how do you also explain it to those who are responsible for upholding those protections? So these questions come up really frequently. And as part of our webinar series, we thought this would be a really great place to start. One of the earliest points in the research process before embarking on actually conducting research. So really thrilled today, really excited to introduce you to our speakers. I think it's going to be a really great conversation. We can go to the next slide. Thank you. So a little bit about the webinar series for anyone who's joining us for the first time. So we have been embarking since early fall, late summer, in a webinar series that, again, is grounded in what we have heard from researchers, practitioners, grantees, applicants to the Kaiser Permanente Center around what would drive capacity in firearm research around the country. And so this is intended to reinforce our commitment to advancing evidence-based, equity-driven, and community-informed approaches to reducing firearm violence, and in particular, in doing research in firearm violence. Again, it was developed with all of this input, so we're hopeful that it's responsive to the needs of the field. And it's also intended to support both researchers and practitioners in working to reduce firearm-related violence, because we believe that research really needs to involve people who wear multiple hats. So we're really thrilled to have had the first of these webinars in which we featured some of our grantees and talked about why research and practice fit so well hand in hand. This is our second webinar in the series, and we're really excited about what's to come. Next slide. So just a little bit of information about the series topics that we'll be covering going forward. So today we're talking about navigating IRBs, and we're really going to get into the nitty-gritty of what it means to really engage with this body in whatever context that you are working. The next webinar is going to be on building trust, community partnerships for firearm violence prevention and research. At the end of this webinar, I will give you all some details, dates and times, et cetera, but we're very thrilled to have that scheduled for February of next year. We're going to be having a webinar after that about going from problem to purpose, so choosing research questions that drive change in firearm violence prevention. After that, we'll be talking about implementation science. So it's not just what you do, it's how you do it, implementation science for firearm violence prevention. And then we're hoping this forms a narrative arc. We really want to end with dissemination. So not just a report, disseminating firearm violence research for impact, how you really use the results of what you learn to change the field. So we're really very excited about all the speakers we have lined up for these. We want to be sure that you stay connected to the announcements around when these webinars are coming out, to register early, tell your friends, because we're really excited about this series. Next slide. All right, so I have the privilege of introducing our speakers today. And I'm going to start with Mr. Neil Urban, who is the Executive Director of MCSR. I think Mixer is part of how that is said. He's a global leader in mobilizing men to prevent gender-based violence. He created the award-winning Men of Strength Club and helped launch Strong Moves, the largest primary prevention program for boys in the United States. Under his leadership, MCSR has reached over 200 million people through initiatives like the Healthy Masculinity Action Project and the Ask mobile platform. Neil has advised a number of federal agencies, national organizations, and is a nationally respected voice in violence prevention and in healthy masculinity. So, Neil, thank you so much for being here. And then I just want to introduce as well Dr. Stephanie Hawkins, who is the Vice President of Public Health Research and Social Policy at RTI International. With over 2 decades of experience, Dr. Hawkins is a nationally recognized research leader specializing in community violence prevention, optimal youth development, and youth impacted by the legal system. She leads multidisciplinary teams dedicated to advancing systems and policy and communication and media impact research. And as we'll discuss today, she sits on RTI's Institutional Review Board. So really looking forward to this conversation. Neil, I'm going to hand it to you.
Great. Thank you so much, Ruth. And good afternoon, everyone. I'm so very honored to be here. Anytime I can be with my sister, Dr. Hawkins, and listen and learn from her brilliance is a great start to my day. I always, whenever I'm speaking to people who are so experienced themselves and are doing such great work, I'm always very clear that I'm sharing what, our experience is and what our approach is to the work, so that you all can be clear. I'm not the expert. We have an expertise that we are really committed to and have seen impact for a long, long time. And so we're sharing to hopefully continue to put the best thinking for these webinar series into the work. I come to Men Can Stop Rape after 10 years of working for the state of Maryland's Department of Health and Mental Hygiene. My background is youth development, youth advocacy, and I'm still very passionate about that. Even as a father of three, I'm still very passionate about my work for young people. And so when an opportunity came to join the nonprofit at the time, Men Can Stop Rape, I thought, I don't understand why that's an emphasis. I don't understand what we're focusing on. And when I came to the organization, what I found out our goal was really to look at the research, what it was saying about sexual violence and particularly specifically rape. That overwhelmingly, when rape was occurring, it was men who were perpetrating that violence, but that the majority of us as men will never perpetrate an act of sexual violence. And so for us, it was important to say, well, if that's the case, then we need to do more work with boys and men so we can continue to create the knowledge, skills, and abilities associated with these young people becoming the best human beings they can, and therefore reduce and prevent all forms of violence, economic violence, gun violence, sexual assault. And so we've really spent the last 28 years um, organizing ways in which boys and men can normalize seeing a part of our identity as men and promoting health and masculinity is in our continued commitment and accountability to preventing men's violence against girls, women, and other people. And that certainly would include gun violence. So when you look at gender-based violence, when you're looking at sexual assault, we're very clear about the lethalities that are associated with gun violence being present, how that lethality is increased when guns are present in a domestic violence situation. And because we do direct service in community, we also are working with young people and adults who are actively carrying weapons, who are already involved in gangs. And so what we've tried to focus on in our work over these last almost 30 years are 4 areas. We provide trainings for professionals who want to learn better how to speak to men around violence prevention so that they can start normalizing and creating language that is colloquial, if it is colloquial or if it's regional, that we work in urban, rural, suburban, and frontier communities. And so we want to offer our expertise to the experts of those communities and help them develop those skills to prevent violence, whether it be gun violence in LA, DC, Chicago, or whether it be hunting violence in other parts of the world. We want to make sure that all forms of violence, particularly related to gun violence or gender-based violence, that are exposed and that we have solutions and strategies for reducing them. So the trainings help us really walk through and meet people where they are around these issues. The other area that we do, we used to do public education campaigns. We don't do as many anymore. Social media and the internet has made it so that when I heard that we had reached 200 million people, that certainly is a marker of the past. Now, reaching 1 million people is a lot more easy, a lot more efficient for people to do. But our public education campaigns also were ways to give everyday normal language to boys and men in communities around how we can prevent violence, how we could get upstream and really emphasize in a day-to-day way how violence prevention is a part of accountability and really promoting strength and intellect, wisdom, and really making that pro-social approach to violence prevention attractive to boys and desirable for men. So those public education campaigns we've had, our strength is not for hurting. It's what was my strength is not for hurting. Hurts one affects all. Where do you stand? And all of those campaigns in different configurations, the Hurts One Affects All was when we were contracted by the Department of Defense to create their first ever sexual assault public education protocol. Certainly in an environment in Washington, D.C., where we're based, the Marines are allowed to have only allowed 6 beers in their dorm room, but they're allowed to have loaded weapons. So we're still seeing that our expansion beyond gender-based violence and community violence needed us both, whether it be the military or community gangs. We were still going to speak to boys and men and their credible messengers around how to prevent the violence that guns produce in whatever community they're a part of. So there's our public education campaigns, our trains for professionals, and then technical assistance to help with work plans, strategic plans. But the place that we really prove our merit and where we can really demonstrate from a research perspective and where Stephanie's leadership and contribution and guidance of us for so many years has been so important is in our youth development work. We really want to make sure that we're developing young people who are confident, who are talented, who are engaged, who are committed to discipline, who are committed to conviction, compassion, empathy. And so really in our Men of Strength Club, which is a weekly program for middle school and high school students that currently this year is operating in 10 states around the country. Here in Washington, D.C., we serve directly about 700 students a year, thousands more through community strength projects. And so these weekly programs take us through our logic model that was collaborated and built with Stephanie Hawkins. Without Stephanie, some of the efficiency of how we do what we do for decision makers who need to see those things wouldn't happen. And so we're so incredibly thankful to her and her teaching of us. So in those programs, the boys and the young women, the young people go through a interactive curriculum where they learn about the knowledge, skills, and abilities of violence prevention and what roles they can play. And then they take those lessons and they create what we call community strength projects. Those projects developed everything from film festivals to voter registration to speak out to teen dating panels. But again, we're really trying to enrich the school environment, the community, that socio-ecological model around violence prevention in all forms. And certainly if we can reduce violence, whether it be fights or car theft, if we can reduce that kind of violence, we believe that the connection also is gun violence will also be down. And as we're seeing gun violence down in DC right now. So those areas for us are really important that we are not just trying to be one thing. It's not just a curriculum. It's not just a training. It's not just a policy. It's not just, a keynote speech or any of those things, but really an ongoing, enduring, sustained way. And Stephanie, I know we're going to talk about it, but as an organization where I'll land and transition this to Stephanie is that we believe in long-term sustainable relationships. And when we're fighting against violence and when we're trying to reduce violence, it makes no sense for us to go to a conference or go to sit on a webinar and be like, oh, I got all the answers. No, we need to continually be in front of this. It's going to evolve. It's going to require new strategies. When I met Stephanie, there was no Zoom. When I met Stephanie, there was no Uber. So there's a reality for us to know that every time we go around the board as a society, we're going to have to collect that $200 and do the primary prevention work and continue to try and find more and more ways to reduce violence in our communities and have everyone accountable for doing so. And I think Stephanie's approach to IRBs and certainly in evaluation strategies have helped us just continue our ongoing learning and education on how to be as impactful in community in reducing violence as we possibly can. And so it's my pleasure to say you all really hold on. If you don't know, I'll turn it over to Dr. Stephanie Hawkins.
Man, Neil, what a layup. Thank you. Thank you so much. So hello everyone. I am really, really happy to be here with each of you. And it's always a good time when I can share space with my friend Neil. So it's a pleasure. And Ruth, thank you so much for the invitation. As I was reflecting on this webinar and thinking about all the ways I've had to navigate IRBs in my own research career, it made me journey back to why I fell in love with research in the first place. I started my career quietly 30 years ago as a student at Howard University in the clinical psychology program. And my master's degree was focused on the impact of community violence on child development. And it was a very focused, community engaged research study. And I met with families who lived in communities that experienced high volumes of community violence. But it was actually primarily firearm violence. And after graduating, I moved out to California and completed a study that explored the prevalence of firearms in suburban communities. So while I view myself as very much an urban researcher, sort of that time out in California, working primarily in white suburban communities, was really illuminating to me as I continued to study the impact of violence on communities, but now in a suburban, primarily white setting. I ultimately returned to the East Coast and have now worked at RTI International, which is a not-for-profit research institute, for the majority of my career, and really remain invested in ways to support children and families living in under-resourced communities. So now, as Ruth shared at the intro, I lead the Public Health Research and Social Policy Department at RTI. And I've worked at RTI for 24 years, so it really has been the majority of my career, and have led various studies over that time. And that is, in fact, how Neil and I came to meet each other. And I'm also a proud founding member of the Black and Brown Collective for Community Solutions to Gun Violence. So that is also another really magical part of my career. But as I think about the span of it, one of the interesting things, and this was not known when Ruth invited me, but I actually serve on RTI's Institutional Review Board. And it's a role that has really enhanced my own research career. I have served on that IRB for well over a decade. And so it is with my lens as a researcher, but also a hat as an IRB member, that I'd love to share a little bit about the role of IRBs. The main purpose of an IRB, which stands for an Institutional Review Board, is to protect the rights, welfare, and safety of human subjects in research. Now, they are mandated by federal regulations, and guided by ethical principles, but it's in a document called the Belmont Report. And I'll share more about those ethical principles in a moment. But let's talk about why IRBs exist in the first place. They were created in response to a history in research where ethical violations took place. So I'll just offer one, but there are many, and I'm certain that you all can relate to some. You probably can refer to some in history or maybe even current ethical violations that you're navigating. But the case of Henrietta Lacks comes to mind for me, and it's a
Mhm.
great example of the value that IRBs bring. So just really quickly, in 1951, Miss Lax was diagnosed with an aggressive form of cervical cancer and underwent treatment. During her visits, doctors took tissue samples from her tumor without informing her or obtaining permission. Now, the cells that were taken from Miss Lax's tumors had a really unique property that made them invaluable in biomedical research, and researchers began to distribute them worldwide without her knowledge, or without the knowledge without her family's knowledge also. So in this case of Henrietta Lacks, the IRB violation was failure to obtain informed consent before taking her tissue samples for research. This case also highlights the lack of respect for persons and the balance between scientific progress and individual rights. Now, this will become more clear because, as I mentioned, there's this document called the Belmont Report. And if we can move to the next slide, it highlights ethical principles that are called out in this report. They are, as you see on the screen, respect for persons. So that's sort of autonomy and informed consent. It's beneficence, which is really how do you maximize benefits while minimizing harm? And then last, which we probably all know very well, justice. So this is really the fair distribution of risks and benefits, such that you are not always going to the same group of people to test out things, that there is an equal distribution, or at least a fair distribution, of those who might experience risk or benefits in the research ecosystem. So that's sort of a very high level overview of IRBs. But the thing that I will want you all to remember, and I'm sure we can get a little more into this when it comes to Q&A, is IRBs are supposed to serve as ethical checkpoints. really to make sure scientific progress is not at the expense of human dignity. Now, I mentioned that I've served on RTI's IRB for over a decade, and I consider it an honor to work on behalf of advancing science, but also upholding human dignity. This is a balance that we all have to engage in. And while I would imagine that if I didn't serve on an IRB committee, I might have a different view about IRBs. But having served on one, and understanding the types of conversations that we engage in those discussions and how we relate and involve and partner with researchers, it really has given me both a unique lens, but as I shared in the earlier part, it's actually enhanced my own research because I think about things differently when I am planning out protocols, when I am thinking about the language in an informed consent. Like, why am I doing this? Why am I writing these words here? So it's provided just a unique lens for me, and I've been really grateful to, as I said, sort of balance and feel honored to balance the advancing the science and upholding human dignity.
Hmm.
So I know we're going to get into questions and Q&A that provide a little bit more detail, and I really hope you all are thinking about your questions that we can engage in. But Neil, I wanted to, I'm going to shift gears back to Neil because Neil and I have this mutual admiration for each other and the bodies of work that we've done. And Neil, as we were chatting about this webinar, one of the things that I haven't been able to anchor is, do you remember exactly when we met? I mean, I know we worked on this study together, but do you remember how long ago it was?
It feels like I know it's the early 2000s because I want to say 2003 or 2.
Mm,
Because I
yeah.
feel like when we first met Rita, I don't remember where you and Monique were in that project, but then when we got renewed based on some initial success, you and I were connected to continue that work, and then it just kept evolving from there. I want to say 2000, anywhere 2002 to 2004, Stephanie, something like
Yeah.
that.
So long time, right?
A long
A
time.
long
Yes,
time.
a long time.
So, just for context, as a researcher at RTI, we were funded by the Centers for Disease Control, CDC. And at that time, they were funding what they call empowerment evaluation. So the idea is not to do the evaluation for a partner, but to work with that partner to enhance their capacity to conduct research on their own. And so I was lucky enough to be teamed up with Neil and Mixer as their sort of evaluation consultant. And so we worked really closely to figure out like what is the work that they're doing? What is the logic model that we can develop to explain their work? So it was really intense, but what it did was just anchor me into the outstanding work that they were doing. And it created this researcher practitioner relationship that has extended decades, right? So you heard we've met about 2002 and now we're at 2025. So when this webinar came up as an opportunity, I just simply text Neil, hey, there's a webinar. And I think we can talk about our relationship and the sort of trials and tribulations we've had to navigate over time. And quickly, Neil was like, sure. There was no question, yes. And so I'm really grateful that, Neil, you said yes. But I think I want us to sort of think together about how IRBs have played a role in the work that we've done
Hmm.
together.
Hmm.
And one of the things that I recall when we first met is how you and your team set up your programming. And one of the things that really came to mind is you all were working in schools. And as many folks know, schools have their own review boards, right? So it may not be an institutional review board like I described at IRB the IRB at RTI, but they do have their own review boards. And some of the requirements that we have to do is getting reviews at the school districts, but also getting research reviews. Um, and as we've worked together, one of the things that I loved is you and your team used to go to schools and ask them, hey, we have a program. Can we work with students in your school? And you were sort of at the will of that particular school and the ways that they wanted to set up your program. Like they would allow you to come in at certain times, they would allow you to do this, you would do that. I would say from a research perspective, that was hair raising, right? Because in research, there are protocols and you have to maintain those protocols, right? Things that we agree to do have to be done. And there
Mhm.
was a shift that happened in your organization where you stopped just accepting what the schools said you could do. And it was, I mean, not to play on words, but it was quite empowering. Like you all decided this is the criteria we need to be successful. And you applied that at every school you went to. And in my memory, you all moved from asking schools to allow you to come in to having a waiting list.
Absolutely.
Am I embellishing or is that right?
No, that's 100% right because what our time with RTI, you thinking through logic models, evaluation protocols, IRBs. From a grassroots perspective, a lot of times we're just so passionate to do the work, right? Now, in some ways, that's a stereotype that they put on nonprofits because RTI is a nonprofit, right? Catholic Church is a nonprofit. Like, there's nonprofits and there's nonprofits. But what it allowed us to have entry into is to learn and to hold what we used to think. Oh, we can teach anybody to work with young people. Well, that's because we're very good at working with community and we're very good at working with young people. But when we start asking the questions of our program and what it is we needed to have the impact and be successful that you were asking us as a part of this process, it really not from an arrogance perspective, but more a strategic perspective to have the biggest impact. Our program works best here when these elements are in place. And we weren't thinking of it that way prior. We were trying to serve as many young people as we possibly could. But our time with you and RTI and thinking from some of that research perspective around what makes us successful has certainly been the thing that has allowed us to go system wide for the last 27 years and
Hmm.
be able to continue. Unfortunately, we're back to a waiting list again because we're working even younger now. We're back in elementary schools. Like I say, we're running, programming across in multiple states. We got charter schools now. We got private schools, suburban schools who post-COVID we're seeing from a mental wellness perspective the harm that that has had on young people and the need for young people to be back in space with one another. But we also see back to the gun violence, the tensions that that brings up. So I think that
Hmm.
that time for us was really, really important to help kind of level set us for the next kind of innovation or direction of our work. And we always have you and our time with RTI and as researchers in our mind when we design a new program or think about it because we're really clear of the benefit of it, but we also know that every circumstance, every moment is unique to itself, and it requires
Yeah.
this kind of checklist of listening to meeting communities where they are. And really that a lot of that started with you in terms of that way of thinking, the words that we're using to describe the program, the goals of what that program is supposed to do, the demographic of the community that we're serving. In DC, we don't have gangs, we have crews, we have streets. It's changed a
Hmm.
little bit. And so these are all things
Hmm.
that, we think about differently rather than just being so passionate about wanting to fulfill our strategic plan or mission or goal. We have to pull back and think that, one of the ways, non-traditional ways to fulfill our mission and strategic plans is really what this relationship has helped us think about and then we continue to think about whenever we launch a new idea or thought.
Yeah. Well, one of the things that comes up in discussions for IRBs that I'm a part of as a committee member, but also, quite honestly, when I was a researcher trying to obtain IRB approval, was incentives.
Mm,
And like, what is the magic amount of funding that we can offer that doesn't hit up against IRB's question about this being coercive
Mhm.
versus this being an amount that values the time that we are asking research participants um, to work with us. And I'm curious how you navigate that. Like, what is Mixer's view on sort of compensation or incentives, and how have you navigated the differences in that over time?
So it's a great question because people, we also provide lunch for our students and sometimes after school snacks. And some people have said, oh, well, you're bribing them. Well, that seems extreme for us. If we're bribing them to do the right thing, I'd bribe more people. If that's what worked, we'd bribe more people. But really, it is just to help set the environment. So when it comes to compensation, we don't believe in free labor, and we believe that violence prevention is a way of life, and so you're going to need to be able to do that uh, uh, in all areas of a person's life. And so for us, we don't think of it as bribing. We think it is so recognizing the seriousness of the work that we're doing. We're all compensated for what we do. And so for young people, we want to get them on the path of saying, look, doing the right thing has reward. Doing the right thing has benefits. And certainly we as a small nonprofit, they're not independently wealthy. But we also like decision makers and researchers to know that when you ask to have access to our students at 11:30 on a Wednesday when they're in school, all that it takes for us to get them positioned so that we can do the research requires some compensation. And so, depending on the task, Stephanie, if we're giving you a compensate or an incentive because you've completed a community strength project and you played a central role in organizing or executing it, you may get a certain price point. If you're going to travel out of state to be a part of a training or technical assistance, and we've got to get your parents involved and you got to get on planes, that's a different price point. But for us, it's all investment in the rightness of violence prevention, and that we don't see it as manipulative or that it's not enough money for them to say, I'm going to quit my part-time job at Chick-fil-A because Neil's going to give me, a $50 gift card for speaking on a panel. So I think it's case by case. We try to make it so that it is in line with our career development work. We try to make sure that it is, you give a kid $10 nowadays. I hate to say this, but you can almost not get a hamburger at Five Guys for $10.
Mhm,
So there's a
mhm.
side where the incentives have to match yesterday's prices aren't today's prices. But also, if you do the math and the analytics of like street crime, you're probably better off getting a job at McDonald's just in terms of economy than
Yeah.
doing hand to hands or being on trying to catch a lick. So I think there's a whole different way that we try to help inform why it's not a bribe, why it is an incentive, why it is symbolic more than it is impactful in in the amount. Because
Mhm.
again, young people are certainly they have expenses in their lives too.
Yeah. So as we sort of close and sort of get prepared for questions maybe from some of the folks who have joined, I think one of the things that I just want to leave and didn't say publicly to you, Neil, is, I think as a research partner, um, I learn a ton by working with you, working with any of the community-based partners I've worked with over the course of my career. And the value of that, the fact that I can text you and ask you to join something is a testament to, I think, our relationship that started. I mean, I didn't know you before. It literally started through this research study. But I think when you have the right partnerships, one that's based on mutual trust and respect, you
Absolutely.
are able to develop a relationship that can evolve over time. Because I have even, gently asked you, do you want to work with a colleague of mine? And told you, like, hey, I'm going to have limited involvement, but, I think it's the trust that you have that I'm not just going to like gently place you with something that's going to not work for you, has worked well. So I want to thank you, Neil, for the relationship we've had over the course of years, and make sure that you know that I've learned a ton from you.
Yeah, right back at you. It's one of my mentors said at the end of a convening we were at, everyone was saying goodbye, and I said, I don't say goodbye. And there's a something Buddhist degree, Buddhist monk who used to work in the Hawaiian legislature, and she says, actually Neil is very correct. the thought that you would ever let go of a resource in the midst of trying to do the right thing in your life and other people's lives. So, Stephanie, we were locked in because I had so much to learn for you. So, I appreciate that you feel that way. And I'm just so thankful that I can. You know what a stunt it is for me to be able to go to decision makers and say, well, Dr. Stephanie Hawkins from Research Triangle Institute, I'm winning that day. So in those moments, it serves both directions because I've learned enough about evaluation from you and your colleagues over the years to know we don't usually get enough money to really do a longitudinal evaluation, which is what some people want us to do. But it is nice to be able to name drop you and RTI, and it's given us entree in a lot of places. So I would just say right back at you and how thankful we are that we can text you and say, well, what does Dr. Hawkins think about it? As a
Yeah.
mantra around our office.
Well, let's get some new friends and see what kind of questions folks have.
I love it. I love it.
So this has been such a great discussion that I honestly hesitate to cut it short. And I feel like this is such an exemplary story of partnership, which is why I'm so thrilled to have you discussing this subject. Because I think that one of the things that has actually already come up in the questions, and I'll just address this at the top because I think it's such a great question, is what if you're starting from a place where, to your point, Neil, the work is the passion, but there's not access to an IRB? And I just wanted to lift up the power of partnerships, which you are both demonstrating so well in your conversation, because that is a reality, right? I think increasingly there are a lot of community-based partners who are realizing they want to be able to demonstrate the impact of their work in their community. They want to be able to tell that story in a way that resonates with various audiences, that can be replicated in a different jurisdiction, et cetera. And that the literature is one way to do that, disseminating research is one way to do that. But if you want to do it well, you really want to be doing it with consideration of human subjects protections. And so how do you do that if you don't have access? So I think there are some innovative and creative ways that we may all be able to collectively imagine the world making this a more equitable research resource. Partnerships, I think, are the short-term answer for sure. Just finding the right your own Dr. Stephanie Hawkins, someone who can work with you to figure out how to facilitate that. There are IRBs available for hire, but they often are very expensive, just to be transparent. And I think it's important to note that that is a place where local stakeholders can partner with you who are interested in the same questions can partner with you. I also just wanted to lift up a couple of the things that you said as we jump into the Q&A. I think, Neil, when you mentioned the different populations you've worked in, we think about vulnerability and trying to protect people who are vulnerable. And people are vulnerable in different ways, aren't they? You've worked with military personnel, you've worked with communities within DC, and there's a lot of different types of vulnerability. So that baseline around human dignity that you lifted up, Stephanie, I think really gives us a way to think about this regardless of what population you're doing research in, because Kaiser Permanente Center grantees work among a variety of populations in a variety of jurisdictions. That human dignity really is the baseline. Neil, I wanted to direct my first question to you. What are the ways that you've seen IRBs strengthen or sharpen a research question? You alluded to this already. And how did you see the IRB actually make the research stronger in those instances?
Well, Ruth, like you said, I spoke to it a little bit. I'll just, to double down. I think it's the continuing education and accountability that you have to have as a direct service provider if you're working with people, a trauma-informed perspective. So, you may think that it was a brilliant idea or intervention or strategy, but you may be too close to it. And, for me, IRBs are, again, about that human dignity, about safety. And so you want to do no harm. And I think people sometimes in the nonprofit space, in the grassroots space, and maybe in others, um, miss that we're not just here for the win, but we're really here to support community and individuals and that human dignity. And so I think in the moments where I've seen it strengthen it is that it's given, as Stephanie spoke to, a different mindset in how you're thinking about rolling something out. You're more measured. You're looking for checks and balances. We don't roll anything out if we've not talked to Stephanie or the DC Rape Crisis Center or the DC Coalition to End Sexual Violence. We want to check and make sure. So to me, that way of existing as an organization is born out of IRBs and evaluation and always having, the safety of others and human dignity at the forefront of our work.
Yeah. Yeah. And I think so you've spoken to how in both your remarks and in what you just said, to how the IRB strengthen. Have you seen the opposite happen? Have you seen a situation where the IRB is dulling the question a little bit or changing it in a way that doesn't really respond to the original needs?
No, this goes back to human dignity because personality gets into it, and then we get into ego. So I'll let Dr. Hawkins speak about the negative impacts of that. But when you get the wrong people whose hearts aren't in the right place, if it's about career, if it's about accomplishment, if it's about attention, then it won't work because the IRB is a powerful tool that is helping you really kind of level set and get clear. Well, the example that I would use is we went to a large urban school system here on the East Coast. Was in DC. Let me shout that out first of all, since we don't have states' rights. Let me shout that out. And in this moment, we were brought in. We went through an IRB process. Everything was successful. But come to find out that we didn't go through the health department. We should have gone through the recreation department. It was some little nuance like that where personalities got in the way of what the data was saying. The data was saying we meet all the standards, but the personality said, well, you didn't come to my office first, so no. So I think that's the place where I would say it wasn't really the IRB, but it was someone's ego. And I think that could happen in reverse. If you came as a grassroots organization or entity that wasn't prepared or a question lifted up and exposed a vulnerability, that you have to embrace that, recognizing, well, then I have to go back and close that gap and fix it because we may do harm. And so I think that rigid nature or the ego getting involved of what the data is telling us, being too wedded to your results, may be a problem.
Yeah, yeah. I'm going to kick this next question to you, Stephanie. I'm curious how you think IRBs can be more inclusive in their processes, whether that be templates, reporting structures, or standards, access, streamlining, city training. How can those kinds of things be more inclusive and include more folks? And how can researchers and IRBs ensure that protection doesn't unintentionally become exclusion?
Yeah, such a great question. So I'll just say that I can only, offer the lens from my experience. On an IRB that's unique to RTI. But I will say, I think I'll use the word empowerment. Like I talked about, what's the purpose of the IRB? Is to protect the rights, the welfare, and the safety of human subjects. I think if we are writing our protocols, because the process is you have to write a protocol, right? If you've got that lens, and you understand, I also mentioned the Belmont report, like the things that these are the regulations that IRBs are based on. This is the mandate for all federal IRBs. You have to have respect for persons. You have to make sure there's this balance of risk and harms. And then you are distributing fairness, right? And who gets risk and harms. If you know that those are the mandates of an IRB, then I think you can think about how do you make sure the populations you are interested in working with, the questions that you're asking are written that you are articulating how it balances this fairness, how that you are not, how you're protecting the rights and the welfare of the participants. I think information is a powerful resource. And I think there are oftentimes people come to IRBs and they just follow these, like this is the template that they gave me, so I'm just following the template. But please do a little bit of work to understand the reasons why you have an IRB. I think you can write your protocols with that in mind so that when you're in that committee meeting and they're asking you questions about, like, why did you select these people from this community? You can say, well, we've weighed the risk and the benefits. Like use the language that we have guiding the mandates as the reason for why we are writing up our protocols in this way. So I think you don't have to be on an IRB to understand the requirements of an IRB. Also, while IRBs are federally required for federally funded studies, they're not necessarily required for studies that are funded elsewhere. However, institutions may require that IRB processes take place. So sometimes you're guided by an institution's protocols. The other piece is I would also advocate and maybe ask the question about how knowledgeable are the committee members? Is there additional information you can provide to the committee members to help them understand the types of research you're doing? Because you have to also understand, like when I'm in my IRB committee meetings, I am asking all the questions, right, about community engagement and how did you do this? Because that's the lens that I come from. Some of my colleagues on the committee lean to me for my expertise there. But if you've got a committee, all of people who are not aware, there may be a gap in their knowledge. So if you know that going in, you might want to offer some additional context to help the committee members understand the perspectives that you're using in your own studies.
Yeah.
Mhm.
I think that's a really important point. One IRB, if you've seen one IRB, you've kind of seen one IRB, right? And they
Hmm.
see the kind of science that they see. And there may be a project you propose, especially when you are pushing the edge of innovation, that's novel. So that's a really
That's
great
right.
point. Neil, in your experience, how well is the role of the IRB that Stephanie you laid out at the top? How well is it understood by researchers you've worked with, by practitioners that you've worked with, by other stakeholders? Do you feel like there's a good universal understanding of what the intent of the IRB really is?
I mean, I don't want to speak about for researchers. I would imagine a researcher would be more familiar with it as a part of their career or the environment they work in. I would say for grassroots people, there's a lot of people who, the comparison I would use is when you hear people talk about something being evidence-based, and then you find out that basically it took attendance. And so for an IRB, for as impactful and as thorough as it could be, I would imagine people who deal with them more regularly are aware of them, and if there's one that you consistently have to refer to. But in the grassroots section, or if I think about our colleagues on the Sexual Assault Coalition, I would think many of us are completely unaware of what an IRB is. We go through a lot of background checks and a lot of clearances and things like that. But in terms of reviewing and the safety requirements of it, I think it's not as known. And again, this depends on the nature. If you're a forensic nurse, you probably are aware of an IRB, maybe more than if you do an after-school program for kids soccer. It just depends on the dynamic. I think about some of our gang and street interrupters. Many of these men and women, very sophisticated and very involved in these formal protocols, and they may be aware of it because they've had to, but I would say they probably didn't come to it thinking about an IRB.
Right, right. I want to revisit this conversation about vulnerable populations. This actually gets to a question that was in the chat as well. There are some vulnerable populations that are kind of predefined that IRBs are going to ask you, are you working with these folks? Yes or no? But there are other vulnerable populations that maybe we're not always thinking about as vulnerable, or that are there are unique considerations. And so one of the questions that was raised in the chat was about someone who might incriminate themselves if they answer questions about their firearm possession or use, if you're doing firearm related research. And that may create, or that may actually expose them to retributive violence. And so I'm curious if you have thoughts about ways to frame this concept of vulnerability so that it's inclusive of the kind of work that we do.
Yeah, it's a great question. I will say that from an IRB perspective, there are U.S. federal regulations, as you noted, that require children, pregnant women, including their fetuses and neonates, and then people who are incarcerated as vulnerable populations. However, right, so these are federally required. So it doesn't matter if you fall into one of these categories, you have a separate set of protocols that you have to go through. But there are also other vulnerable populations, and those would be considered people who are easily influenced. So people who might be deemed economically or educationally disadvantaged. Right? If you are economically disadvantaged and you're offering lots of money to participate, right, you would be considered a vulnerable population depending on how that IRB protocol is. Someone who's cognitively impaired, when there's an imbalance situation, you've got students and faculty members. So I think it's important to consider, what does vulnerability mean? Now, when it comes to the types of questions that are being asked, that's different. That really is balancing risk and harm, right?
Yeah.
So if you are asking a person, how many times have you, fired your firearm, right? Like, the question is that the type of question that is needed for you to get the results you have to get? And how are you protecting this individual if they say yes?
Yeah.
So there are lots of different protections, right? As a research study, you may or may not have to turn over your data, right? But I would make sure that we are asking only the questions we really, really need to understand, not what's nice to know, but what's needed to know to get to the answers that we want. And there are times when we may have to think twice about asking that explicit question because we may be putting persons at risk. But that's something the research team really needs to weigh, right?
Yeah.
Because we don't know always the backgrounds and experiences of the people that we might engage. And so if someone is on probation and they're admitting to a crime, that's going to be a problem.
Yeah.
It doesn't matter why did you ask that question, right? Like, so I think we have to just be careful how we do it and then make sure we've got the right protections in place for those participants. It could be
Yeah.
anonymous, right? It could be other ways that we gather that data that don't put individuals at risk. And that's actually the role of the IRB to protect
Yeah.
the research participants.
And that may be an example of sharpening the question. You thought I'm just
Yeah,
going to ask this question. The IRB says, oh, there may be unintended consequences to asking it in that identified way. Can you get that
right.
information and still and protect the human subjects that you're working with
Correct.
better? And now you've sharpened you've gotten what you need, but you've protected people along the way. That's,
Correct.
I think, an
Correct.
example of the system working right. Yeah, I think that's really powerful. I just want to take a moment to say there are so many phenomenal questions in the chat. So we are making a plan right now to save the questions that you are all submitting so that we can attend to them appropriately. Because there's a lot of what you are asking are questions that we definitely have on our agenda, but I'm conscious of time and I know that we are going to be closing in just a few minutes. So please know we're saving them so that we can actually take some time to figure out how to get some of these practical answers to all of you. And thank you for your engagement. I really appreciate it. I wanted to talk a little bit about consent with you, Neil. I think we've all seen the consent forms, the templated consent forms that are sometimes very, very long and include a lot of information. I've had students and trainees ask me before, do we really think that participants are reading these? And then there's like a power dynamic piece too, right? So depending on what role you play and the person that you're asking to consent, that may weigh in. How do you think about what it really means to be informed when you're giving consent?
Well, I think in our youth programs is where I would speak mostly because it's all volunteer, right? These young people are selecting to be there, and we feel like that is a great baseline for us to start with. Working in the youth facility, the state of Maryland brought those students to us. So there was a different, right, there wasn't as consensual in that situation for their IEPs and ITPs and that kind of thing. But in our community-based work, we feel like the consent piece, and certainly MCR consent is so central to accountability for us. But we like the fact that, we approach it by it's an invitation. And we really want to empower people with as much information about the decision they're going to make so they can really be informed. And inevitably, like I say, we do trainings for 3 days, and inevitably someone will say, oh, you missed this variable in your 3 days. So, I don't think we always try to factor for every potential challenge to someone being as informed as they can to make a decision. But we certainly want to emphasize that and lift that up to them ahead of time that they are in an ongoing, enduring way at all times, able to step away to end the participation. We just want to really continue to check in with them. So I think it's a both and depending on the topic of what the IRB is focused on, where their authority to make those decisions, that consent. We really want to demonstrate that as just always ever present as the most strategic way that we've found. But I'm sure there's, amongst our colleagues, they have a whole host of other ways that they would, and Stephanie certainly probably does as well.
Hmm. Yeah, any thoughts on that, Stephanie? That's great.
Yeah.
Thank
Again, I'm going to go back to why do we even have it, right? We talked about Henrietta Lacks at the beginning. This was someone who wasn't asked to participate in something. So when you're doing informed consent, I also know, because I've been on the other side, like this is really long. Are they understanding? So reading comprehension and literal comprehension are key. So some of the strategies you can do is make sure the requirements, because there are requirements like who's funding this, what the limits to confidentiality are, like how much you're being compensated, like those things are important to know. How much time is it going to take to do this program or this survey? But maybe reading it to the participants in addition to passing the consent form out to make sure they actually understand what you're saying. Everyone's reading level is not the same. Even if you try to write it at a sixth grade reading level, like everyone doesn't quite get that. So, I mean, our responsibility, if we want someone to participate in our studies because we believe in what we're asking, then it is on us to make sure your participants understand what they're doing. You want that as a researcher or as a community partner. You want them to understand. So the informed consent is really important because it is that human dignity piece that we talked about.
Mhm.
It's not a requirement for a requirement's sake. You want these people to say yes or no, they want to participate. So I
Yeah.
think there's a balance between how much we write and maybe a strategy for let's write this out and then let me give a voiceover so that you understand and we can get through this pretty quickly.
Yeah, yeah, absolutely. So, just as a last question, and then we'll do some closing information for our participants today. Thank you both for this incredibly rich discussion. This has just been phenomenal. And this gets to a little bit of something that was also mentioned in a question in the Q&A, is this idea of like what the community advises, right? So the Institutional Review Board is saying, here's how we protect people. Does the community have a voice in that? Heard people talk about community advisory boards or community review boards that are basically doing the same thing, but their expertise isn't necessarily the ins and outs of clinical or biomedical research. Their expertise is like, what is the impact of this really going to be on a community? And I'm curious if you've
Mhm.
heard that idea kind of elevated for the future and what you think of it.
I love it. So, in different studies that I've been either a part of or have been in an IRB committee reviewing, we do have community advisory boards. And the process may be that they develop the protocol, they run it through the community advisory board. Once they get that tweaked, then they submit it to IRBs and see what feedback they get. And then it's a give and take. So the process might take a little longer if you're
Yeah.
doing that, but you're getting the type of buy-in and commitment to the language and the outcomes that you want. You'll just have to navigate feedback between the community advisory board and your institutional review board.
Yeah. Yeah.
All I would add to that is it builds great credibility that you're willing. People talk a lot about meeting people where they are. Well, sometimes that takes some time. You're gonna go. You don't just get to go there, and you got to go and stay for a little while. So I think it's a great opportunity to get to know the community and to let them weigh in, and certainly identify some of the gaps and nuances that may be laying in wait for you if you're not of that community. So that just would be really, from a community perspective, amazing to have a resource like that.
Yeah, absolutely. Thank you both so much. If we could throw the slides back up, please. We just want to take a moment to let everyone know about the next webinar. So this has been fantastic. We saw all the questions about just practical resources and sample templates and things. So we're going to take a look at all of that, but really appreciate the engagement. We want to be sure to mention our next webinar. We're very excited to feature Dr. Catherine Bocanegra, Edwin Galletti, and Kelly Carroll from Chicago, talking about built on trust community partnerships for firearm violence prevention research. Highly relevant to what's come up today. How do we work with community in a meaningful way? How do we build that trust, Neil, that you were just alluding to? And so we're very, very thrilled. We'll be having this conversation on February 26th from 1 to 2 Eastern Standard Time. So please register and join us for that. Again, thank you all for the conversation. Thank you, Stephanie. Thank you, Neil. We really appreciate it. Have a wonderful afternoon. Oh, yes, and a quick reminder, please do the survey at the very end of this webinar as well. Thanks so much.
Thanks, everyone.
Bye,
Bye.
everyone.
Bye, Dr. Hawkins.
Goodbye, Neil.